Hello, and welcome to Dr. Lawrence Forgacs and Eye Care Associates in Optometry. It's so good to be with you again. Today, we want to talk about a comprehensive eye exam and what you can expect when you come to Eye Care Associates in Optometry here in Manhattan. We take great pride in providing the best possible eye care exam in New York or anywhere else you might go for your eye exam. The first thing we do is we have every patient fill out a comprehensive medical eye history report. It looks like this. And we sit down with the patients and we go over each item on that list. We want to know about your past medical history, any medications you're taking. We want to know about your family history. Everything starts with genetics. So if your parents have problems with their eyes, or your grandparents had problems with their eyes, you may get the same genetics as they had, and you may have those same kinds of problems. So it's important to know about your past medical history and your family history. A lot of medications that patients are taking have side effects, which can adversely affect the quality of their vision. Antihistamines can cause your eyes to be drier. Antidepressants can cause your eye muscles not to coordinate as well. Can also cause your eyes to be dry. So we like to know everything about your past medical history and any medications you're taking which might have adverse effects on the quality of your vision. So we review all that with you. And we also want to know when you saw your last eye doctor, if he told you that you had anything to worry about. Sometimes patients come in and they'll just say, I'm just here for an eye exam, and they don't tell us that the last doctor they went to said, oh my gosh, you have high eye pressure and you need to worry about glaucoma. So we like to know all those kinds of things when you come in here. So please share any information that your doctor told you at your last visit with us, so that gives us a helpful hint on where we're going to start and the kinds of tests that we might need to do for you. So basically, for every patient, the first thing we do is we test their vision on the eye chart with and without their current glasses if they have glasses, or with and without their contact lenses if they're wearing contact lenses. We can update your glasses prescription and your contact lens prescriptions here at Eye Care Associates. So we like to do all the tests that we need to do to make sure that your glasses are going to work the best for you and that your eye muscles and your eye coordination is working the best for you. So one of the first tests we do is a fusion test to make sure that your eyes are fusing properly and coordinating properly. Then the next test we do is your color vision, to make sure your color vision is working properly. If your color vision is not working properly, that can adversely affect patients in certain occupations. So then we do what's called a refractive keratometer. This gives us a little printout on your refraction and the curvature of your cornea over your pupil. That's very helpful to us when we're determining your new eyeglass prescription. We're also going to do the eye pressure test. And no, we don't use Mr. Puff. We haven't used Mr. Puff in years. Nobody liked Mr. Puff, so you don't have to worry about Mr. Puff in this office. We use a Goldman tonometer, the most accurate way to check your eye pressure. We're also going to do a test on your pupillary reflexes to make sure your pupils work properly. Your pupils are connected to your brain, and there can be problems inside your head that can adversely affect the way your pupils react to light. And that can affect you how you see at nighttime and how you adjust to different levels of lighting. So pupillary reaction is very important, and we do that as part of every comprehensive eye exam. We also do visual field testing, and this is what the visual field tester looks like when you're doing the test. It has little flickering patterns on the screen that you have to click on the button every time you see one, and we can use that information to determine whether or not the signal from your eyeball to the back of your head, the occipital cortex, to the vision center is working properly. It's very important that those signals get back to the vision center and that that's working properly. So we do visual field tests on every patient when they come in here. The next thing we do for patients that are wearing contact lenses is called corneal topography. It looks like this. This information tells us If there's any irregularities on the surface of your cornea, any distortions, microscopic dry spots, anything that could adversely affect the quality of your vision with your glasses or with contact lenses. So some patients that have dry eye problems, we're doing corneal topography on them as well to look to see if the surface of their eye is wetting properly or if there's any irregular patterns as a result of their dry eye condition. Very important. Also, when patients are here, we oftentimes take photographs of the outside of their eye and the inside of their eye. Photographs are very valuable in determining from one visit to the next whether or not there's been any subtle changes that have occurred since your last eye exam. You can make all the little drawings you want and notes you want, but nothing's better than to have a photograph to be able to compare to from 1 year to the next. Once we're done with all of our testing, we're going to write up a prescription for you on a little prescription pad like this that you get to take home with you after the exam. If you needed any medication, we're going to write up a prescription for medication and make sure you have a copy of that to take with you. Sometimes when we're trying to do transfers of these prescriptions to the pharmacy, something goes wrong and it doesn't get there. So when you have your own paper copy to take with you, that can help ensure that you're going to get that prescription right away. The conclusion of the exam, we go over everything with you and we write up a to-do list. That to-do list is invaluable. When patients walk out of here, they oftentimes forget the instructions that we've given them. And this way they have a written copy of everything we've discussed with them during the exam to take home with them to make sure that they have a reference that they can go back to and remind themselves what Dr. Forgacs said he wanted you to do every day of the week, all year round, to help keep your vision strong, your eyes healthy, and to help keep you functioning as best as you can in your workplace, at home, out on the ball field, wherever you use your eyes. We want them to work for you as best as possible. And I hope everybody has a wonderful Thanksgiving holiday. Be safe out there. It's so good that we're able to travel and get together with our relatives again. Everybody's been hiding out for the last couple of years, and this is a good time to get out there. Hopefully the weather will be good, but drive safe. God bless, and we'll look forward to talking to you again soon.